discuss the drugs which are used for bronchial asthma or any other respiratory distress which leads to bronchospasm and difficulty in breathing. So the important class of drugs are drugs which are used for bronchial asthma. We can see in the figure in asthmatic patient the bronchioles or the airways are constricted or the airway patency is not maintained because of swelling, mucus accumulation and other complications. So the main disorders in the respiratory systems are usually bronchial asthma, asthmatic bronchitis, which is usually an inflammation associated with the asthmatic attack, exercise induced asthma, status asthmaticus. Status asthmaticus is a dangerous condition which can be life threatening. Seasonal asthma, which arises during a particular season like during winter or during spring season. Aspirin sensitive asthma, which is observed in some patients who are taking an aspirin. And chronic obstructive pulmonary disease, COPD, chronic obstructive pulmonary disease, which is commonly encountered in chronic tobacco smokers. So coming to asthma, it's a chronic inflammatory disorder which can result in an obstruction in the airway due to bronchospasm and difficulty in breathing. And the characters of airway in an asthmatic patient will be an airway hyperreactivity. Not everyone gets asthma in all the conditions. Only few patients, also few individuals get such an asthmatic attack because of hyperreactivity of the airway, and it leads to an inflammation which is a reason for the bronchospasm, and finally the severe bronchospasm and difficulty in breathing. These are the three characters which are observed in an asthmatic patient. So you can see in this figure, this is a normal airway, while this is what is being affected in an asthmatic patient. So this is so much constricted and there will be difficulty in breathing. So the aim of anti-asthmatic drugs are mainly to relieve the acute episodes of attack of asthma. So when there is an asthmatic attack, the quick relief medication is always a bronchodilator, so that they can relieve the bronchospasm and the breathing or ventilation can be made easy for the patient. And second, to reduce the frequency of attack, that is a prophylactic or a controlled therapy to prevent the attack of asthma. So they are usually anti-inflammatory drugs because asthma is a chronic inflammatory disorder. Coming to the classification of the anti-asthmatic drugs, first is bronchodilators, which is a quick relief medication. Sympathomimetics is the first class of drug. Selective beta 2 receptor adrenergic agonist like salbutamol, terbutaline, salmeterol or formoterol. Salbutamol is a very fast acting drug, especially on inhalation or on IV administration or even during nebulization, while other drugs are mainly used to prevent the bronchospasm in asthmatic patient, either by oral route or as a syrup or as a tablet. Methylxanthines, next class, which is also a bronchodilator like theophylline, aminophylline, etophylline or derphylline. And the last class is anticholinergics, ipratropium bromide and tiotropium bromide. So these three classes belongs to bronchodilators and they are quick relief medication and they are mainly used to relieve the bronchospasm associated with the asthmatic attack. While coming to a controlled medication or prophylactic therapy to prevent the asthmatic attack, the important classes one is leukotriene receptor antagonist, Safurulucas and Montelukast. Why leukotriene receptor antagonist? Because leukotriene is one of the major mediator of asthmatic attack in the humans. That's why this drug is gaining more importance in preventing the attack of asthma. Second, mast cell stabilizers like sodium chromoglycate or cromolyn sodium, nitrochromin and ketotifen. So mast cells, they releases histamine, along with that so many mediators which are responsible for the inflammatory reactions. So if the mast cell can be stabilized and prevent the release of inflammatory mediators from the mast cells, it can prevent the inflammation of the respiratory tract or the airway and can prevent the asthmatic attack. Now, fourth one is LOX inhibitor or lipo-oxygenase inhibitor. Repeat, lipo-oxygenase inhibitor, Siluton, because lipo-oxygenase is the main enzyme which is responsible for the production of leukotrienes, which is the main mediator of asthmatic attack. And fifth one is glucocorticoids, which are powerful anti-inflammatory drugs. There's two classes. One is inhaled glucocorticoids, which can be inhaled like meclobetazoline, budesonide or fluticasone, and systemic glucocorticoids, which can be taken either orally or parenterally, either by IV route, like hydrocortisone, which can be given by intravenous route, prednisolone or prednisolone, which can be given by oral route. Coming to sympathomimetics, first class, which is a beta-2 adrenoceptor agonist. Beta-2 adrenoceptor agonist, very selective on beta-2 adrenergic receptor, which are located on the bronchial smooth muscles, resulting in bronchodilation. Coming to mechanism of action, they stimulate beta-2 receptors located on the bronchial smooth muscles, which can stimulate adenylyl cyclase enzyme, increase CAMP and bronchodilation. It can also inhibit the mediator release from the mast cells to some extent and increases the mucus clearances by ciliary activity or improving the ciliary activity. Advantage of beta-2 selective agonist. Even we can use adrenaline, but adrenaline will stimulate all the adrenergic receptors. So what is the advantage of a very selective drug which can selectively activate beta-2 receptors? So there will be minimal cardiovascular side effects because beta-1 receptor is not stimulated. Suitable for asthmatic patients with a hypertension or heart failure because other beta receptors which are responsible for elevating the blood pressure are not affected. Disadvantage, there can be risk of tachycardia on overdosage. On overdosage, large amount of syrup like salbutamol, asthalin syrup, if it is taken in a large amount, it can even stimulate the beta-1 receptor, leading to increase in heart rate or tachycardia or palpitation. Skeletal muscle tremor because of facilitation of neuromuscular transmission, nervousness, and finally tolerance, which can lead to decreased effectiveness of the drug. Adverse effect, mainly palpitation on overdosage, skeletal muscle tremor again on overdosage, restlessness, nervousness, throat irritation, angle edema, which is rarely observed. Palpitation and skeletal muscle tremor is very commonly observed because the syrup is not being taken as prescribed amount, it is being just simple swallowed. Indication, mainly used for bronchial asthma, especially during acute attack. You can see that figure, inhaled salbutamol, very effective for preventing the acute attack of asthma, asthmatic bronchitis, exercise induced asthma, status asthmaticus, seasonal asthma, aspirin sensitive asthma, and chronic obstructive pulmonary disease. And salbutamol, it can be given as inhalation or oral or as a IV bolus or IV infusion or even as a nebulization. Thank you.